Haley, assessment plan and goals. Haley lives at home with her mom and dad and older brother. Haley is an active child and enjoys active play outside. She is a member of the swim team and attends swim practice on weekdays. Haley spends a majority of her days playing with her friends. She is independent in community mobility and rides her bike to swim practice to see her friends. Haley enjoys both active and passive leisure with her family, including going on bike rides and watching movies. We chose the model of human occupation as our occupation-focused model for this client due to its focus on the dynamic interaction between the child's thoughts, feelings, and actions, as well as its subjective and objective measurements. Haley experiences anxiety around schoolwork that may stem from her own beliefs around her skills and abilities with academics. This may impact her performance in school and other areas. These subjective thoughts have a direct impact on Haley's occupational identity. MOHO will help guide clinical reasoning by identifying thoughts and beliefs that may have an adverse effect on Haley's performance, as well as identifying strengths that could be used to facilitate positive change. Additionally, MOHO will inform us what types of questions we may ask to obtain a full understanding of her self-belief in the areas of volition, habituation, performance capacity, and environment. We decided to use the cognitive behavioral frame of reference in addressing Haley's assessment and interventions. The cognitive behavioral approach will allow Haley to build self-confidence and support her ability to set realistic goals and coping strategies when she becomes frustrated due to anxiety regarding school and in overcoming challenging situations. We can also address the way that Haley's thoughts and emotions influence her behaviors and school performance. This will help guide our clinical reasoning by planning activities that are challenging but will allow Haley to be successful and provide her with adequate support during interventions to help guide her confidence. This will also help guide our goals by targeting her coping strategies during stressful situations and identifying her own strengths to build her self-confidence. By doing so, we can further address Haley's performance within the school setting to increase her academic participation. Initial meeting, Fred and SDQ. Haley has strengths in performance patterns of routines and roles as a friend, daughter, and sister. These performance patterns can be utilized within intervention planning. Haley has a supportive physical home environment where she has access to her own bedroom and other spaces to participate in arts and crafts. The home also has a gym where she is able to exercise. She also has a supportive social context as evidenced by her large friend group and involved parents. This supports her occupations in social participation, IADLs, and school participation. According to parent report, it is likely that she has strengths in joint mobility, muscle power, and muscle endurance. She is very active throughout the day, and the client factor of energy and drive is likely a strength. Further, it is likely she has strengths in performance skills of endures and coordinates. This is very supportive to her occupational performance, as children at her age are very active and enjoy engaging in active play. Further, it supports her participation as a member of the swim team. According to parent report, Haley may struggle with client factors of emotional and temperament and personality, and may have difficulties with the performance skill of expressing emotion. As mom reports, Haley has difficulty with following directions and giving verbal refusals during transitions and removal of preferred activities. Although these behaviors occur at home, there are no current teacher reports of this at school. Areas to target in interventions include transitions and behavior management at home. This would include coaching mom on behavioral management strategies and Haley on social-emotional regulation. Haley has anxieties surrounding her academic performance that cause distress to her. She often becomes frustrated when doing homework. Haley's mom also reports that Haley struggles to ask for help in the classroom setting. In total difficulties of the SDQ, Haley scored 9 out of 50, indicating she is about average and unlikely to have any significant difficulties. Haley is also performing similarly to peers in the prosocial peer problems, hyperactivity, and conduct problem skills. This indicates that Haley does well with other children, has good attention, follows directions from adults, and is polite to others outside the home. Haley scored 5 out of 10 in the emotional symptom scale, indicating that Haley may have many fears, worries, and anxieties, particularly in new situations. The results from the SDQ indicate that Haley has strengths in the client factors of attention, higher level cognition, and temperament and personality outside the home. Further, these results indicate strengths in performance skills of social interaction skills. These factors likely support Haley's participation within various occupations, including social participation and school participation. The results from the SDQ indicate difficulties in the client factor of emotional. Haley has many worries and easily loses confidence in new situations. This will likely be a limiting factor across occupations, including social participation, school participation, and within new IADLs and other new activities. Haley would likely benefit from further occupational therapy evaluation and treatment in order to target emotions and promote future participation in meaningful activities. Second meeting, COSA and observation. We use the COSA to identify what Haley feels she is doing well and what is challenging for her. Under our guiding model of MOHO, it is important for us to gain a subjective measurement of Haley's beliefs in these areas. The COSA provides Haley the opportunity to give us her perspective on how she feels she is doing in a variety of tasks. Haley rated doing things with her family as the most important item on the COSA. She reports that she has a little problem with this and specifically stated she has a difficult time getting her brother to play with her. Additionally, Haley reported having some difficulty with eating her meals without any help, getting her chores done, having enough time to do the things she likes, keeping her mind on what she was doing, and finishing what she was doing without getting tired too soon. This indicates that Haley may have some difficulties with the client factors of attention, energy, and drive. This may cause difficulties at school with paying attention to the teacher and getting schoolwork done. Haley reported that these items are all very important to her. Further, Haley has some challenges with calming herself down when she is upset, thinking of new ways to do things when she has a problem, asking her teacher questions when she needs to, and buying things herself. This indicates that Haley may have challenges with the client factor of emotional and higher level cognition and social interaction skills of questions. This may impede her school performance by impacting her ability to complete schoolwork, ask for clarification or help from a teacher, or remain attentive in class if she becomes emotional. Haley rated these items as being important to her, which informs us that these would be areas to focus on for her goals. We observed Haley complete a Go Noodle interactive dance and active game in order to assess her ability to follow directions and transition between activities. Using the Go Noodle platform allowed us to incorporate the computer into the activity, yet still get her up and moving around to observe how Haley uses problem solving to overcome obstacles as well as frustration tolerance. Haley did very well with the Go Noodle dance activity and with the Go Noodle active game, displaying good attention, quick learning, and did well with adjusting to challenges as they arose. She exhibited high frustration tolerance in response to game and dance challenges. Haley displayed strengths in the mental function client factors of attention, temperament, personality, energy, and drive. This will support her social participation, school participation, self-care, and IDLs, as she is able to attend to task demands and maintain enough energy to complete activities. Further, Haley exhibited strengths in muscle strength and endurance. This allows her to participate in her meaningful occupation of swimming. Further, she is able to ride her bike to swim practice and to meet up with her friends in order to engage in social participation. Additionally, this supports family participation, as she is able to go on bike rides and engage in active play with her family. Haley's goals. Goal number 1. Haley will independently identify emotions using the zones of regulation during 4 out of 5 opportunities within 1 year. The first short-term goal. Haley will identify 2 emotions that she feels in each of the 4 zones of regulation with assistance from OT within 3 months. Second short-term goal. Haley will use the zones of regulation to identify which zone she is in currently with verbal cues during 3 out of 5 opportunities within 6 months. Short-term goal 3. Haley will use these zones of regulation to independently identify which zone she is currently in during 3 out of 5 opportunities within 9 months. Goal 2. Haley will independently transition from a non-preferred activity to a preferred activity without verbal refusals on 4 out of 5 opportunities within 1 year. Short-term goal 1. Haley will transition from preferred to non-preferred activity with 3 or fewer verbal reminders on 3 out of 5 opportunities within 3 months. Short-term goal 2. Haley will transition from preferred to non-preferred activity with 2 or fewer verbal reminders on 3 out of 5 opportunities within 6 months. Short-term goal 3. Haley will transition from preferred to non-preferred activity with no more than 1 verbal reminder on 3 out of 5 opportunities within 9 months. Long-term goal 3. Haley will independently utilize a cognitive coping strategy when she is experiencing a fear, worry, or anxiety on 4 out of 5 opportunities within 1 year. Short-term goal 1. Haley will independently identify cognitive coping strategies that she can use in response to a fear, worry, or anxiety on 4 out of 5 opportunities within 3 months. Short-term goal 2. Haley will utilize one cognitive coping strategy in response to a fear, worry, or anxiety with visual cues on 4 out of 5 opportunities within 6 months. Short-term goal 3. Haley will utilize one cognitive coping strategy in response to a fear, worry, or anxiety with no more than 2 verbal prompts during 4 out of 5 opportunities within 9 months. Thanks for watching.